CEN Test Prep YouTube channel. Question 1. A patient with chest pain has a 12-lead ECG showing a new onset left bundle branch block. The emergency nurse should prepare the patient for a stress test, immediate transfer to a medical surgical floor, coronary angiography, observation for 6 hours. Question 2. Which laboratory value is most specific for acute myocardial infarction? CEN-B, myoglobin, troponin I, BNP. Question 3. An adult patient with acute asthma exacerbation is not improving after 3 rounds of nebulized albuterol and ipratropium. The nurse anticipates oral corticosteroids, intravenous magnesium sulfate, discharge home, chest physiotherapy. Question 4. A 4-year-old presents with a 2-day history of a rash on the neck, chest, and back. The lesions on the neck are crusted, and the chest lesions are tiny vesicles on a pink base. The child has a temperature of 39.1 degrees Celsius. The father asks when the child can return to school. The nurse advises 24 hours after the last fever above 38.3 degrees Celsius. Tomorrow, once all the lesions are crusted. In 2 weeks when all the lesions are crusted. Question 5. A patient presents with descending paralysis and areflexia following a recent viral illness. The nurse suspects Guillain-Barré syndrome, multiple sclerosis, myasthenia gravis, stroke. Question 6. A drowning victim is brought to the ED. The major physiological insult is hypothermia, pneumonia, hypoxia, dysrhythmia. Question 7. A patient presents with altered mental status, meiosis, bradycardia, and copious secretions. The nurse suspects organophosphate poisoning. The treatment is naloxone, flumazenol, atropine and pralidoxine, activated charcoal. Question 8. A patient with a history of seizure disorder is actively seizing for 5 minutes. The nurse's priority is to place a tongue blade in the mouth, restrain the patient, administer 4-lorazepam. Start in 4. Question 9. A 2-year-old child presents with a barking cough, stridor, and respiratory distress. The nurse suspects epiglottitis, croup, foreign body aspiration, asthma. Question 10. A patient with type 1 diabetes presents with vomiting, abdominal pain, and a serum glucose of 650 milligrams per deciliter. The nurse anticipates the following laboratory finding: respiratory alkalosis, metabolic alkalosis, metabolic acidosis, normal anion gap. Question 11. A patient with COPD and a history of carbon dioxide retention is receiving oxygen via nasal cannula at 4 liters per minute. The nurse notices the patient is becoming lethargic. The appropriate action is to increase the oxygen to 6 liters per minute, decrease the oxygen to 2 liters per minute, prepare for intubation, administer naloxone. Question 12. A patient with a history of asthma presents with respiratory distress, minimal air movement, and an absent wheeze. This finding indicates the patient is improving. A silent chest, indicating severe bronchospasm. A pneumothorax. The patient needs a bronchodilator. Question 13. A patient presents with sudden onset pleuritic chest pain and shortness of breath after a long flight. The nurse's priority is to assess for myocardial infarction, pulmonary embolism, pneumothorax, asthma exacerbation. Question 14. A patient with known borderline personality disorder presents with superficial wrist lacerations. The nurse's priority is providing emotional support, suturing the wounds, assessing for suicide intent, discharging the patient home. Question 15. A patient presents with sudden onset of severe, diffuse abdominal pain, vomiting, and a history of alcohol use disorder. The nurse anticipates an order for NG tube placement, serum amylase and lipase, abdominal CT, all of the above. Question 16. A patient with a history of sickle cell disease presents with severe back and chest pain. The nurse suspects musculoskeletal strain, vaso-occlusive crisis, pulmonary embolism, myocardial infarction. Question 17. A patient presents with an opioid overdose with respiratory depression. The nurse should administer flumazenol, naloxone, activated charcoal, atropine. Question 18. A state senator is being treated in the ED, and a staff member discusses his care with a local reporter. The facility is most likely to face a lawsuit for false imprisonment, defamation, libel, invasion of privacy. Question 19. A newborn with meconium-stained amniotic fluid is delivered. The nurse should suction the mouth and nose immediately, dry and stimulate the infant, perform a brief assessment and begin ventilation if needed, intubate and suction the trachea. Question 20. A patient is brought to the ED after being struck by lightning. Which finding is most concerning? Confusion, unequal pupils, tachypnea, hypertension.